Today, women can access an enormous amount of personal health and fitness data. We can know how we slept, how stressed we are, how active we have been, and where we are in our menstrual cycle. But having information does not necessarily tell us what to do with it. The user still has to interpret all of these different signals and decide what action to take. That's the gap LOTUS is to close. Health data does not automatically translate into actionable decisions. To make this concrete, let me introduce you Emma. Emma is 31, active, and works full-time. Her goals are pretty ordinary: improve her fitness, eat well, sleep better, manage her stress. But she notices that a workout that felt effortless last week feels exhausting today. Her cravings get stronger at certain times, depending on her cycle phase. Emma already has access to plenty of health and fitness data. What she doesn't have is a way to connect all of it into a decision about today. What to eat, how hard to train, when to rest. Her question is simple: what should I do today? And that's exactly the question LOTUS is designed to answer. So, how does LOTUS actually work? It runs on a simple three-step model: track, understand, and act. First, track. LOTUS can take in the menstrual cycle data, symptoms, sleep, stress, activity, energy, cravings, and the user's own goals. Second, understand. LOTUS looks across all of that and identifies the individual's own partners, not a generic template. Third, act. It turns that understand into practical recommendations across exercise, nutrition, well-being, and recovery. And this part is important. The menstrual cycle is treated as one variable among several, not a prescription. LOT doesn't assume every woman should behave the same way just because she's into the same phase of her cycle. It looks at her actual symptoms, partners, goals, and lifestyle before it recommends anything. Let's walk through what that actually looks like for Emma on a given day. Today, she is in her luteal phase. She's had poor sleep, her stress is high, she's craving sugar, and she has high-intensity workout scheduled. LOTUS looks at all of that together and recommends a short breathing exercise for her well-being, suggests her consider a lower intensity session instead, offer 3 snack options aligned with her goals, and recommends she prioritize her early bedtime. Then it's simple ask her, how are you feeling now? And that response feedback into her individual story. So the recommendations keep improve over time.
You've reported feeling stressed today. Take a moment to reset. Technology that helps you pause, understand, and reset.
So how does that compare to what's already out there? Cycle tracking apps like Floor or Clue are strong on cycle tracking and personalized guidance, but limited when it comes to wearable data and pulling everything into one integrated daily action. Wearables like Garmin or Aura are excellent at capturing sleep, activity, and recovering data, but their guidance is generally less personalized to the cycle, and again, limited to turning everything into a single daily plan. LOTUS focus is connecting the dots, combining cycle data, wearable data through integrations, and personalized guidance into one contextualized daily decision. And I want to be careful with the frame here. We are not saying nobody else does this. We are saying LOTUS is specifically designed around turning multiple sources of women's well-being data into one integrated daily decision support experience. That's LOTUS as a product. Now I want to shift the gears, because this is where technology becomes law. LOTUS isn't simply collecting information, it's collecting health-related information, interpreting it, and then make personalized recommendations based on that interpretation. And that raises a real legal question. At what point does personalized well-being guidance stop being lifestyle advice and start being healthcare? In the Australia context, three legal frameworks are directly relevant to LOTUS. First, privacy. The Privacy Act 1988 and the Australian Privacy Principles, which govern how we collect, use, disclose, and secure personal information. Second, therapeutic goods. The Therapeutic Goods Act 1989 and the TGA's regulatory framework, which determines whether laws would actually be treated as a medical device. And third, consumer law. The Australian consumer law, which governs the occurrence and substitution of any health or well-being claims we make. I will go through each of these in turn. Starting with privacy, and this matters a lot for LOTS because we would be handling genuinely sensitive information. Menstrual cycle data, symptoms, mood, sleep, stress, and general health and fitness information. Under the Privacy Act, health information is treated as a sensitive information. Australian Privacy Principle 3, APP3, imposes additional requirements on the collection of sensitive information, include obtained consent, unless a specific exception applies. So LOT's response to that is to build a privacy by design from the ground up. Informed and specific consent, collecting only what's genuinely necessary, being transparent about why data is collected, giving users control over any integrations, provide access and corrections mechanisms, secure storage and deleting or de-identifying data once it's no longer needed. APP11 reinforces this. It requires reasonable steps to protect personal information from misuse, loss, or unauthorized access, and requires the information be destroyed or de-identified once no longer needed, subject to certain exceptions. Next, we examine the Therapeutic Goods Administration framework. Under Section 41BD of the Therapeutic Goods Act 1989, a product is a medical device if it is intended by the manufacturer to be used for the diagnosis, prevention, monitoring, treatment, or alleviation of a disease, injury, or disability. Under TGA's regulatory guidelines for digital health and software as a medical device, general wellness software that solely provides lifestyle, fitness, or general stress management advice is generally not regulated as a medical device. LOTUS intentionally positions itself within the general wellness domain, avoid diagnostic language or medical interventions. This leads to a point that I think is genuinely important. The same underlying technology can have a completely different legal status depending on how it's described. If LOTUS says, your stress is elevated, here are some well-being strategies you could try. That's wellness positioning. But if LOTUS said, our system identifies your anxiety and provides treatment, the same technology suddenly moves into potential medical device or therapeutic territory. And the TGA is explicit about this. Intended purpose isn't just about what the software technically does. It's also reflected in the advertising, the instructions, the labeling, and the technical documentation around it. So the design principle for Lotto is we have to control not only what the technology does, but what it claims to do. And there is no more layer on this, what I think worth flagging. Even a future software update can change in Lotto's regulatory status. If an update introduces, say, diagnostic support or clinical monitoring, software that wasn't previously regulated could become a medical device. So compliance for LOTUS isn't a one-off decision made at launch. It's something that has to be reassessed every time the product changes. Under the Australian Consumer Law, set out in Schedule 2 of the Competition and Consumer Act 2010, Section 18, prohibits conduct that is misleading or deceptive, while Section 29 prohibits false representations regarding product performance or benefits. In the digital health sector, the ACCC strictly requires business to substantiate health-related claims with credible evidence. LOTUS enforces strict marketing governance. We refrain from making unverified therapeutic claims such as curing PMS or balancing hormones, ensuring all promotional statements clearly reflect evidence-based lifestyle recommendations. To summarize our compliance frameworks, LOTUS operationalizes legal risks across four pillars. First, privacy compliance through granular consent models under APPs 3 and 11. Second, TGA boundary management by enforcing non-clinical software boundaries and subjecting every software release to regulatory review. Third, Australian consumer law compliance by validating all user-facing statements against ACCC substantial standards. And fourth, algorithmic governance to prevent automated drift into diagnostic territory. To bring this together, LOTUS is built around a simple idea: track, understand, and act. Technology can genuinely help women make better everyday decisions about their health. But innovation like this has to have boundaries. The real challenge for a startup like LOTUS isn't only what technology is capable of doing, it's about what it should be allowed to do. With the legal frameworks, what exists to protect the people using it. That's all. Thank you.